So going on with your thing with the TennCare, have you or your family members ever experienced difficulty paying medical bills?
Well, we have had with TennCare, because Jenny is on SSI and she's disabled, they cover everything. But the problem is they don't pay very well. So when we try to get our prescriptions or our services filled, we're constantly met with, oh, we don't take TennCare, or we're not going to take TennCare anymore, they don't pay their bills. And then when I call TennCare and say, okay, can you please send these people some money so Jenny can get her oxygen or something? And they say, oh, well, they're not supposed to discuss, they're not supposed to discuss money with you. Well, they have to, because I want to know why they won't help me.
Right.
So it's just kind of an ongoing nightmare.
Well, we have private insurance, and it's decent insurance. But Jacob's medications, out-of-pocket deductibles is over $350 a month for us. That's hard to come up with sometimes. Not to mention the copays and deductibles for seeing the doctor's office. Tim, Zach, you guys had any of those problems too?
Yeah. You want to start?
Go ahead.
Definitely, and we ran into the same problem with the private, and just being in Blue Cross Blue Shield, where when we first went to go and visit Dr. Boob, even though he was under Bonheur, his practice had an issue with the insurance company, and it was now out of insurance, and so that wound up being something that that early visit was something that we had to go into arbitration on for over a year, almost a year, before we finally got something settled. Even though he was the only person in our area that was specialized in what Anna's specific situation was. So, I think that ours is a big case, but that it's another case where private, even with having a private insurance, you're running into serious problems.
Yeah, well, I think the whole discussion here, highlights how complicated the issue is. I consider myself a relatively intelligent person. I don't know what the answers are in dealing with this. We have been fortunate that we have not had any major issues with our private insurance carrier. We are blessed that we have very good insurance, and in talking with people at Bonheur, talking with people like Michelle, I realize how blessed we are. But it's complicated. Insurance companies, I'm not an expert. I think in some ways they are set up to deal with somebody like me. You don't make a lot of claims, you're relatively healthy, and when you have, first of all, a child, and then you have a child that is chronically ill, that there are a lot of claims made, it becomes very difficult, it's hard to to get through that paperwork, and you run into some of the issues that you run in with TennCare, and I think that's just a function of bureaucracy. I don't know how you solve that, but that is a big issue for parents, and I guess this kind of goes to the education aspect of helping parents deal with these kind of things, and I think that's one of the good things about our group and groups of parents that can help educate other parents that may not be aware of how to deal with these issues.
And I'd say that our doctors have done everything they can to try and help meet us. They realize that there's a real situation going on out there, and that it doesn't seem to be getting better, and they're finding creative ways to make sure that the care stays at the level it needs to stay, at least in our experience, and we really appreciate that.